And West Streeting, the Health Secretary, have been boasting about wait lists coming down, and that 80,000 number, the highest level in a single month inside 2 years. Let's look at the actual facts. Let's look at the facts. So what has happened is, and excellent reporting, to be fair, to the Times, who stated that in that month, 340,000 people were removed from waiting lists as a result of an exercise called, quote, validation. That is where the government literally pays hospital trusts to remove people from waiting lists for reasons including that they've tragically passed away, or the NHS has deemed them no longer needing such treatment. That is 80,000 more, and this is where it gets really ridiculous, 80,000 more than the prior month. That is that exact 80,000 that Keir Starmer has been boasting about, and he's literally on his Twitter about how much the waiting lists came down. So the state of the NHS is so desperate now that the Prime Minister of this country, Keir Starmer, is boasting about wait lists coming down because British people have been waiting on waiting lists so long that they've tragically passed away.
But we don't always know that those things are connected.
Here's the even worse statistic, that hospitals in this country actually performed fewer operations, right, and fewer procedures and appointments, 10% fewer than the prior month. 10% fewer. So this is literally pure gaslighting. It's nothing to do with actually a better functioning NHS, which is why the 7 million people in England, 9 million people in total in the United Kingdom who are on elective waiting lists, including a lot of people watching this show, no doubt, Michelle, who are saying, as we just heard, I'm not seeing any evidence that I'm getting any better treatment for the NHS or wait lists coming down.
I just want to
so it is
actually
not extraordinarily dishonest and gaslighting to tell the British people wait lists are coming down, when really the reason they're coming down is because tragically British people are dying.
And procedures. That is not always a consistent number across 12 months of any particular year at all. And you've said that the government have gaslighted people and have very clearly explained here, as you have said, some people on those waiting lists have sadly passed away, but that is not always connected to the reason why they're on that waiting list, waiting for that particular procedure, operation, treatment, whatever it is. The government has asked NHS trusts, who are organisations who are paid by the government to run things, and they've said, you need to do this to make your services more efficient. We will pay you to cover the cost of this service. That has made their services more efficient. That is why you're seeing this data.